Welcome to all. I am Dr. Uday Kumar, Naturopathy and Yoga Department, AdLife, Baswatarakam Indo-American Cancer Hospital. On the occasion of International Day of Yoga, as you all know, we are conducting Zoom classes on yoga and health awareness. Now we will start the session with yoga for allergic problems, especially in this pandemic COVID-19 situation. Whatever asanas you have to perform, this will go to in the protocol. Now over to Dr. Bharatwaj. Sit in Sukhasana, spine erect, close your eyes. Concentrate on your breathing. Start with prayer. Namaskara Mudra. Sangachatvam samvadatvam samvo manansi janatam deva bhagam yadha purve sanjananamupasate sanjananamupasate Sanjananamupasate. Rub your palms and do gentle massage to your eyes, ears and neck. Then slowly stand in Hastasana. We will start the session with loosening exercises, Chalana Kriyas, and keep your hands on your waist. Griva Shakti Vikasaka, neck loosening movements. Keep your head straight, spine erect, and inhaling slowly extend your neck back. Exhale, bend forward. Inhale, extend your neck back. Exhale, bend forward. One more time. Inhale, extend your neck back. Exhale, bend forward. Come back to Samata Sthiti. Neck half rotation and keep your head straight. Then slowly turn your head right side. Then come back to center. Turn your head left side. Come back to center. Again turn right side. Come back to center, turn left side, come back to center, one more time, turn right side, come back, turn left side, center. Now turn your head rotation, neck rotation. While breathing in, slowly bend your head forward and turn right side. While breathing, take it back. While exhaling, turn left and front. Now reverse. Inhale, turn left and back. Exhale, turn right and front. Again, inhale, turn right and extend your neck. Exhale, turn left and front. One more time. Inhale, turn right and extend your neck. Exhale, turn left and front. Again, reverse. People who have a vertigo problem, they are not supposed to do this exercise. You can avoid this one. And come back to center. Shoulder movement. Inhale, lift your hands parallel and above the head. Exhale, bring it down. Inhale, extend your neck, extend your hands. Exhale, bring it down. One more time. Inhale, take your hands above the head. Exhale, bring it down. Next, shoulder rotation. Keep your palms, touch your fingers on the shoulder. Now, inhaling slowly, take your hands up. Exhale, bring it backwards and down. Inhale and exhale. And one more time. Inhale, exhale. Now you do it reverse. Inhale and exhale, bring it front. Inhale, go back. Exhale, front. One more time. Now come back to normal position. Now tongue twisting, spinal twisting, Katichalana movement, and keep a distance of 1.5 feet apart between your feet and stretch your hands front, parallel and palms facing each other. Now inhaling, slowly twist your body right side and exhale, come back to center. Inhale, twist the left side. Exhale, come back. Again, inhale, twist. Exhale, come back to center. Inhale, twist it. Exhale, come back. Back to normal. Next, knee movement, squatting position. Keep 1 foot apart between your feet and stretch your hands front, palms facing down, and slowly kneel down. Come back. Again, slowly come down, come back. One more time. Come back. Next, keep your hands on your waist and stand in Thadasana. Now you will do Thadasana. Feet little bit closer. Now slowly take your hands above the head And lock your fingers in front of the body. Now inhale, slowly stretch your hands above the head. Pull up. Exhale, bring sideways. One more time. Lock your fingers. Inhale, slowly stretch your hands above the head. Feel the stretch in calf muscles, entire your spinal cord and your fingers. Exhale, come back. Next, we will do Vajrasana, tree pose, feet together. Now fold your right leg, keep it at the root of the left thigh. Slowly take your hands parallel and turn your palms facing up. Take your hands above the head. Join your palms. This will help you to improve the concentration, memory. Separate your hands, slowly bring your hands parallel, then turn your palm facing down and bring it down. Keep your leg down. Same thing we will do with the left leg. Fold your left leg, keep it at the root of the left thigh, right thigh, then slowly take your hands parallel, turn your palms facing up, take your hands above the head, join your palms. You should have a samadrushti. Separate your hands, slowly bring your hands down and leg down. Next we will do Pada Hastasana. And this is the forward bending posture. People who have lower back pain, they don't attempt this asana. Who have a lower back lumbar spondylosis and slip disc, they should not attempt this asana. Now slowly inhaling, slowly take your hands above the head. Bend backwards. Exhale, bend forward. Touch your palms by the side of your feet. Then take your head towards your knees. Normal breathing. Inhaling, slowly take your hands above the head. Exhaling, bring your hands by the side of your body. Next, Ardha Chakrasana, and take the support for your lower back with your palms. Inhaling, slowly bend backwards. Hang your head back. Best exercise for lower back pain. Exhale, come back. And now hands down. Next, we'll do Trikonasana. Inhale, bend backwards. Exhale, come back. Now we'll do Trikonasana, triangle pose. And people who have a back pain, better not to attempt. And keep 2 feet distance between your feet. Keep your hands parallel. Now first we'll do right side. Turn your right foot. Then slowly bend along with the right leg. Look at your left hand. Your gaze should be on the left palm. Straight up. Then turn your foot inside. Come back to normal position. Now same thing we will do left side. Again, keep your legs apart. Keep your hands parallel. Turn your left foot outwards. Bend along with the left leg. And turn your head and look at your right palm. Bring your head straight, then come back straight, then turn your foot inside and bring your feet closer. Next, sit down, stretch your legs front, next Vajrasana, we simply call it butterfly movement, Baddha Konasana. Slowly bring your feet closer and your heels should touch your perineum, and keep your spine erect and try to bring your knees down. Either close your eyes, maintain the posture. This is one of the best pelvic floor exercise. It strengthens the pelvic floor muscles. Then stretch your legs. Next, Vajrasana. Keep your hands by the side. Then fold your right leg. Keep it beneath the right hip. And fold the left leg. Then keep your palms on your knees, spine erect. And close your eyes. Concentrate on your breathing. This is one of the meditative pose, and this is the only asana one can perform immediately after meals. This will improve the digestion, aids in digestion. Next, Ardha Uttanasana, and stand on your knees. Then take the support for your lower back with your palms. Then slowly inhaling, extend your neck back and push your chest front. Take normal breathing over there. Exhale, come back. sit down, sit in Vajrasana. Next, Uttana, that is Camel Pose. Stand on your knees and keep 1 foot apart between your knees as well as feet. Then slowly take one hand back and hold your right heel. Take the left hand back. Hang your head back and push your hips front. Take normal breathing. Concentration should be where you have stretch. Lift up your head first. Then bring your left hand front and right hand. Sit in Vajrasana. Next, Shashankasana. In same sitting Vajrasana. Then hold your hands back. Pull your hands down, spine erect. Exhaling, slowly bend forward while stretching the spine front. And touch your forehead on the ground. In this, even you can keep your hands even front also. Stretch your hands front. Inhale, slowly take your hands above the head and come back to Vajrasana. Now stretch your legs front, sit in Dandasana. Chakrasana. And fold your right leg, keep it at the knee and bring your left hand around the knee. Try to hold your foot. Look back. Twist your spine and stretch out your toes of the left foot. This is one of the best exercise asana for diabetes mellitus. It stimulates the pancreas, controls the sugar. Bring your head back to normal. Then release the hand, stretch your leg. Same thing you'll do with other leg. Fold your left leg and keep it at the knee and take the right hand around the knee. Twist back, then stretch out your toes of right foot. Bring your head front, then release the right hand and stretch your leg front. Separate your legs. Keep your hands a little bit back and hang your head back and relax. feet together. Now lay down on your tummy, Makarasana. Keep your palms under your knees. Separate your legs, toes outside, heels inside. Keep your arms under your head. This is prone position, relaxing posture, Makarasana. It is a crocodile pose. Next we will come to Bhujangasana, Cobra pose, feet together, heels together, chin on the ground. Keep your palms beside your chest, elbows close to your body. Now these fingertips should not cross your shoulder line. Inhale, slowly lift up your head and chest, up to navel, elbows close to your body. Look at the ceiling, gaze up. Your weight should be on your lower back. Exhale, come down. Now relax in Makarasana. Separate your legs. Next we'll do Shalabhasana, Locus pose, feet together, chin on the ground. Keep your palms under your thighs, elbows should go inside. People who have a severe backache, don't attempt this asana. Inhale, slowly lift up your both legs, maximum, and hold the posture, take normal breathing. Exhale down. Take out your hands, keep your arms under your head, spread your legs. Relax in Makarasana. Next, supine poses. Lay down on your back. Now we'll do Setu Bandhasana. Now, bridge pose, best exercise for lower back pain. It gives a soothing to the lower back, soothing effect. Fold your knees. Keep 1 foot apart between your knees. Hands close to your body. If you are able to hold your legs, you can hold it. Now inhale, slowly lift up your waist. Push your hips up. Maximum. Stretch your body up. Feel the stretch. Don't lift your shoulder. Exhale down. Stretch your legs. Separate your legs, separate your hands. Relax in Shavasana. Next, Uttana Padasana. Feet together, hands close to your body, palms facing down. Inhale, lift up both legs, 1 foot above the ground, both feet. That is Ardha Halasana. That is Ardha Halasana. Maintain the posture there only, 90 degrees. Stretch out your toes. Take normal breathing. Exhale down. Separate your legs, separate your hands. Palms facing up. Pavanamuktasana, feet together, hands close to body. Inhale, lift up your both legs, 45 degrees. Exhale, fold your knees, hold your knees. Pull the knee close to the tummy. And stretch out your toes, breathe out. Keep your head in between the knees. This is called Pavanamuktasana. Any gastrointestinal problems, indigestion, dyspepsia, excellent asana. Keep your head back, release your hands. Inhale, stretch your legs 45 degrees. Exhale, keep it down. Spread your legs, spread your hands, palms facing up. Leave it loose. Relax in Shavasana. Close your eyes. Feet together, hands close to body. Slowly turn one side, left side. Then now we'll do sit down. Sit in Sukhasana. We'll do Pranayama. First we start with Kapalabhati. Kapal means skull. Bhati means cleaning. Kapalabhati, it cleanses all Kapala related organs, including sinuses, nostrils. It is active exhalation, passive inhalation. Relax. Now we'll do sectional breathing. Keep your hands on the waist and the tummy. We'll do abdominal breathing. This called yogic pattern of breathing. Inhale and push your stomach out. Exhale and stomach should go inside. Inhale and push your tummy out. When you breathe in, your stomach supposed to come out. When you breathe out, it's supposed to go inside. Only your stomach supposed to move. This will help you to increase the lung capacity, especially lower lobes of the lungs will be inflated. It improves the lung capacity, vital capacity. Exhaling, pull your tummy inside. Again, inhale, push your tummy out. Exhale, pull inside. This is called abdominal breathing. Next, thoracic breathing. Keep your hands on the chest. Inhaling, slowly expand your chest. Your chest should expand. Exhale, bring closer. Only chest is supposed to move. Inhale, expand your lungs, especially chest. Exhale, bring closer. Here your tummy not supposed to move, only your chest movement should be there. Inhale, exhale. One more time. Inhale, expand your lungs, chest. Exhale, bring closer. Now, clavicular breathing. Keep your hands on the shoulders. Now inhale and only lift your shoulders up. Exhale, down. Inhale, lift your shoulders up. Exhale, down. Inhale, up. Exhale, down. Bring your hands down. Come back to Sukhasana. Put chin mudra. This is called sectional breathing. Next we'll do Nadi Shodhana Pranayama. That is also called Anuloma Viloma Pranayama. Use Nasika Mudra and close the right nostril with the thumb and ring and little finger for closure of the left nostril. First, breathe out through the left nostril completely. Again, breathe into left nostril slowly and deeply. Then, close the left nostril and release the breath from the right nostril slowly and completely. Again, breathe into the right nostril slowly and deeply. Close it and breathe out through the left nostril. This is one round of Nadi Shodhana. We'll do 2 more rounds. Inhale to the left nostril. Exhale from the right nostril. Inhale to the right nostril. Slowly and deeply. Exhale from the left nostril. One more round. Inhale to the left nostril. Feel the fullness when you breathe in. Exhale from the right nostril. Feel the emptiness when you breathe out. Again, breathe into right nostril. And breathe out from the left nostril. This is Nadi Shodhana Pranayama, Anuloma Viloma Pranayama. It balances your both nadis, Ida and Pingala. Now we do Bastika Pranayama. Bastika Pranayama is the brisk breathing exercises. Here we have a active inhalation and active exhalation. In Kapalabhati, only active exhalation. Here both are active. Start. Active inhalation, active exhalation. Good. Relax until your breath come back. Sometimes people who does initially, they may feel giddiness, dizziness. Once your breathing get back to normal, then you can attempt next pranayama. Now Suya Beda Pranayama. This is the right nostril breathing. Right nostril breathing is called, it is a Pingala Nadi. It is a Suya Nadi which produces the warmth in the body, especially people who suffer with respiratory allergies in the winter season and rainy season, and it is a very helpful for them. Close the left nostril, breathe into right nostril slowly and deeply, then close it and exhale from the left nostril. Then again inhale to the right nostril, slowly and deeply. Exhale from the left nostril. The ratio should be 1:2 ratio. If you inhale for 5 seconds, your exhalation should be approximately 10 seconds. It should be. Even you want to follow bandhas, even you can follow by holding the breath. Anta Kumbhaka, even Bahya Kumbhaka also you can do. But initially you feel suffocated. That's why I'm not teaching you Kumbhakas, bandhas. That is Surya Vedana Pranayama. Next we will do Bhramari Pranayama. Bhramari means it is a humming bee sound we should give while exhaling, and this is also called Nadan Sandhana Pranayama. Plug your ears with thumb and close the eyes with index finger. Now inhale to the nostrils slowly and deeply, while exhaling give a humming bee sound. You should enjoy the vibrations, feel the resonance that relaxes each and every part of the body. Again, take a deep breath and give a humming bee sound. It gives the meditative effect. It gives a resonance to entire your body, especially skull. One more time. Exhaling, give a humming bee sound. Relax. Enjoy the resonance, vibrations, the three-dimensional effect of the resonance and vibration. Today's session we close with Shanti Mantra. Sahana vavatu, sahanau bunottu, sahaviryam karavavahai, tejasvinamadiitamastu, ma vidvishavahai. Om Shanti Shanti Shanti. Thank you. Shubham Bhuya. Yeah. Till now, we have seen the common yoga protocol, and in that also we have gone through the different kinds of breathing techniques. Breathing is the one of the vital, important for the living. Without breath, we can't live. Not more than 2-3 minutes. Yeah, breathing is basically it's oxygenation. And today now we will discuss about the respiratory issues. Respiratory system consists of the mainly upper respiratory tract and lower respiratory tract. Upper respiratory tract will have a nose, pharynx, larynx, and trachea. And lower respiratory tract will have a bronchi and bronchioles and alveoli. And this upper respiratory tract will have a, basically you will get a upper respiratory tract infections. You will get mostly the pharyngitis, sinusitis, allergic rhinitis, laryngitis. These are the common problems you will get in the upper respiratory tract infections. Lower respiratory tract infections, commonly you will see the allergic bronchitis and chronic bronchitis like COPD kind of disorders. People who smoke, they will have a emphysema and they will have a chronic bronchitis and bronchiectasis. These are all the commonly you will see. But why we get the respiratory allergies? Because of one is because most commonly is the smoking is the one of the major, and also allergy to the pollen or allergy to the dust or anything which stimulates, which irritates the nasal mucosa, then it will cause the inflammation. That initially it will develop as a upper respiratory tract infections. These upper respiratory tract infections, once you neglect it, then it will turn to be a lower respiratory tract infections. Then it will lead to chronic like emphysema, COPD problems once this will develop. Now we come to the basic anatomy. The gases exchange will take place in the lower respiratory tract, especially in the alveoli. Alveoli means it is just like a grape-like structure, which is having in the lungs, where the oxygen and carbon dioxide exchange will take place. Alveoli is a very large, that's the surface area of the alveoli is almost, it is what equivalent to one tennis court. When you expand the alveoli, then it is almost that, but we hardly, in a normal day-to-day life, we don't use the alveoli very effectively. The lung capacity, we hardly anything use, not even half we use. In that situation, especially pranayama, breathing techniques, these will help you to improve the lung capacity and vital capacity. And especially in allergic, in naturopathy and yoga, it deals in these respiratory problems in 3 different types. One is main is a diet part, second is the breathing exercises, and third is the physical naturopathy treatment modalities we use, these three things all together will helpful in prevention as well as curing of the respiratory allergies and chronic respiratory disorders. Diet part comes a major role, especially in this winter season and rainy season. People who have a tendency of the respiratory allergies, they should not eat certain kind of foods. These are age-old traditions. We are seeing that especially milk and milk products and animal source of proteins, which will have a tendency of producing the mucus formation. Once the mucus is formed, automatically they will develop the nose block and the respiratory, the breathlessness, you will start and you're not able to breathe. That's why you should stop the eating of animal source of proteins, milk and milk products, and non-veg and bakery items and soft drinks. These kind of foods you should avoid. In the Tamil Nadu area, generally you will see night time, they don't eat any like usirikaya, that's nallikaya, that's called amla, they don't eat because it's a phlegm-forming foods. That's why you should not eat these kind of foods. Citrus fruits also activates your mucus synthesis. That's why you should avoid citrus fruits, especially people who have a tendency of cold, cough, and sneezing and respiratory allergy, they should avoid citrus fruits also. Then what one can eat? Apart from milk and milk products, they can eat all other things, normal spicy foods, normal foods, and normal salt, normal chilies, and they can eat especially kashayam, made up of black pepper, jeera, and ajwain, and these things, and tulsi, basil leaves you should mix up in that, and prepare a decoction. They can consume decoction 50 ml in the morning, 50 ml in the evening. That will help in soothing your throat, especially, and as well as arresting the mucus formation. Apart from kashayam, one can have a jeera water, one can have a clear vegetable soups, hot soups. They can have any other herbal drinks, hot herbal drinks also they can have. And apart from that, they can have anything which is served hot, they can take. And in acute situation, even fasting therapy, intermittent fasting therapy, or short fasting therapy, that will help in, it gives a very good relief even in asthma cases also. One can follow 1 or 2 days of only suitable liquid diet they can follow that will help in reducing the phlegm formation and it clears the lungs. And they can, one more thing is they should not eat heavy meals. Sometimes heavy meals aggravates your asthmatic attacks and bronchitis attacks. WhatsApp. That's why heavy meals should be avoided and they should take light meals. And also one more thing, night dinner time and sleeping time, they should maintain at least 2 to 3 hours gap. Because immediately after eating food, if you go to bed, then the chances of developing bronchitic attack or asthmatic attack chances are more. That's why you should not eat very late. And also you should maintain that and avoid spices and heavy food in the, especially in the night. Second comes is the pranayama. Pranayama, there are 2 types of exercises, that is slow and deep breathing exercises and brisk breathing exercises. Slow and deep breathing exercises consist of especially Anuloma Viloma Pranayama, Ujjayi Pranayama, and Brahmari Pranayama, and Surya Vedana Pranayama. These are very important pranayamas which will help you to improve your lung capacity, that vital capacity, and also forced expiratory value we call. That these things will be improved by practicing slow and deep breathing exercises, and the ratio should be, it should be like a 1:2 ratio. Like if you breathe in for 5 seconds, you should try to breathe out for 10 seconds. That's the depth is important than the number. You should try to increase the depth from day to day so that your lung capacity will be improved. Apart from that, you can do sectional breathing. Like in yoga, we call it as abdominal breathing and thoracic breathing and clavicular breathing. These sectional breathing practices will be helpful in improving your lung capacity. And one is Surya Vedana Pranayama. Surya in yoga, in pranayama, there are called three nadis, Ida, Pingala, and Surya, as Sushumna. Ida means it's a Chandranadi, Pingala means Surya Nadi. Surya Nadi means it's the right side breathing, the right side nostril breathing. That is called Surya Vedana. If you breathe into the right side nostril, it will generate the heat in the body. It is very helpful in cases of respiratory allergies. And Ujjayi Pranayama, these are all will improve lung capacity. Apart from that, brisk breathing exercises called Kapalabhati and Bastika Pranayama. Kapalabhati, Bastika Pranayama are very, very useful in case of upper respiratory allergies like sinusitis and allergic rhinitis, because this will desensitize your mucous membrane so that you doesn't prone to these kind of allergies. And also it drains the sinuses because it creates a vacuum. When you do forcefully exhale, that your sinuses will get be cleared. And apart from that, you can do yogic kriyas like Jalanit. Jalanit is a simple yogic kriya. When your nose is blocked and sinuses get infected, if you do, there is nothing but a principle. It runs on the principle of osmosis. We use a hypertonic solution, and it is simply called nasal irrigation. Hypertonic solution. Then we put in one nostril, and water will come out from the other nostril. Because we use the saline water, that's why automatically the congestion in the nasal mucosa will be, it is cleared, and you can breathe properly. There's one more yogic kriya, Sutaneti, that is with rubber tube. We clean the nasal cavities. And apart from that, there is other kriyas like Gajakarni or Kunjala kriyas. That is taking warm early morning. You take the warm water with little salt and you warm it out and you cleanse your stomach. Sometimes even acidity and gas formation, dyspepsia, that will also aggravate your asthmatic attacks and bronchitis. That's why you should do Kunjala kriya, Gajakarni we call it. That is helpful in yogic kriyas. And apart from this, diet and this thing, and there are certain physical modalities of naturopathy will helpful in getting rid and curing and preventing. That are the facial steams. With normal, you can use a turmeric or eucalyptus, you can apply in the facial, or you can take a plain one. You take a facial steam inhalations will helpful, and salt water gargling, that will any laryngitis, pharyngitis cases, the salt water gargling will help you to clear the throats. Any infection is there, it will clears. And apart from that, you can use other therapies like a spinal manipulation, like spinal massages will helpful, and hot and cold chest packs to the local application to the chest, that will improve it relaxes the lung so that the congestion will be removed. And spinal spray bath and spinal bath and other therapies will helpful in getting rid of this nasal mucosa. And total complete steam bath also will helpful in subsiding the problem. All together will helpful. You have to follow the diet along with it, pranayama, and these physical modalities will helpful. These are all simple day-to-day. You can practice at home also. Without going to the hospital, you can cure your simple problems like allergic rhinitis, sinusitis. These things you can solve your problems at house level. If it is going to be severe, then you have to consult the concerned doctors and take the proper advice, and you can use these therapies as an adjuvant if it is in severe cases, along with other therapies what the doctor prescribes. Okay. Thank you very much. Tomorrow we will meet with some other topic like obesity and its comorbidities, especially the diabetes. Tomorrow, same time, we will meet you again. Thank you.